gas grenade! Ah, I'm salivating, lacrimating, urinating, defecating, vomiting. My GI tract is extremely motile.
I'm Claire Barton, a nurse, and I'm here to assess your bowel sounds, your respiratory rate, and your heart rate to see if we can figure out what's going on. It looks like you're all having symptoms of organophosphate poisoning, which include salivation, lacrimation, urination, defecation, and emesis. Your bowel sounds are extremely hyperactive, and your heart rate and your respiratory rate have increased as well.
Yeah, we were hit by a nerve gas grenade earlier. What can we do about it? Will this ever stop?
Well, I can give each of you an injection of a drug called Atropine or Atropine. It is an anticholinergic drug that dries your overreactive secretions like the ones you are experiencing right now. It has many uses, but for you guys, it will aid in treating organophosphate poisoning, which we already discussed was from the exposure of the nerve gas.
You said shot. Where exactly do you mean to give that?
I will give you 1 to 2 milligrams intramuscular, which means into your muscle, and it will go into your thigh. I give this to you every hour until your symptoms disappear.
And what sort of things comes along with this medication? There's always a catch. Side effects?
Good question. You may experience some dizziness, a headache, a fast heart rate, dry mouth, and probably some constipation.
Right now, constipation and a dry mouth sure sound good. Can I just have the whole bottle?
Well, I can't give you the whole bottle. A toxic effect could cause seizures, depressed respiratory effort, and sometimes dysrhythmias. Also, if you experience any blurred vision or chest pain, let me know right away. You guys won't be able to operate any heavy machinery with atropine in your system, and I also want you to avoid high temperatures, because you will be way more prone to heat stroke.
Sounds like we are all getting some time off. No battles, no driving tanks or armored personnel carriers.
Nope, probably not for a while. Do any of you have any more questions?
Yeah, I use some over-the-counter medications regularly. Is that a problem?
Well, we will have to check with the doctor. Some medications are contraindicated. When we get to the hospital, please provide me with a list of your medications. Okay, so we're going to go ahead with the shot now.
Okay.
Okay, if you guys can get into my helicopter, we will head to the base hospital where you can follow up with a good friend of mine, Florence Nightingale.
Okay, let's go.
Hello, soldiers. I'm Florence Nightingale. I'm here to administer your next 1 milligram intramuscular dose of atropine. First, I will perform a head-to-toe assessment and reassess your vital signs that Nurse Clara originally obtained in the field. Although we want to rid you of the signs and symptoms of organophosphate poisoning, we do not want to cause any adverse reactions to atropine such as tachycardia, difficulty swallowing, ataxia, hallucinations, delirium, and a coma. Death from atropine poisoning is rare, but is usually due to the paralysis of the medulla centers in the brain when used in excess. Hopefully none of you have been diagnosed with glaucoma, tachycardia, or asthma, because the use of atropine is contraindicated. We should also remove your contaminated clothing, wash your skin, and commence artificial respiration and supportive therapy as needed. I will inject atropine into the opposite thigh from your last injection. It can also be injected into your deltoid muscle in your upper arm if the dose is 1 milligram or less. I will maintain proper hand hygiene by changing my gloves and washing my hands after each of your injections. I will also dispose of my needles properly in a sharps container. Improving sanitation and reducing soldier mortality is very important to me.